I see a normal, otherwise healthy male come into my office with 0 sperm in their ejaculate. They go to the gym, they exercise, they eat healthy, they're not overweight, they don't have diabetes. You would never really know otherwise. And it's actually the Wi-Fi that impacts sperm motility, morphology, and overall concentration.
What are the stats on that? Because what is the infertility of men? What does that look like? Does size matter?
I'm seeing these young guys in my office, late 20s, early 30s, doesn't matter. They're coming in for infertility, but they also have erectile dysfunction. They basically counteract the ability to get an erection.
Is there anything men should look for if they're feeling a certain way or think that could indicate maybe subpar fertility? Fertility is a team sport, but there is still so much optimism and hope around what's within your control. Hi, my name is Vita, WeNatal co-founder, and this episode is a fun one. I interviewed Dr. Ariel Muradsadeh, but I also invited my husband, Sean, to join us. We talked about all things, how to do it, when to do it, all the top burning male fertility questions. And if you know my husband, you'll know he's super funny and you guys are gonna enjoy listening to this episode. So excited to have Dr. Muradsadeh here today. He is a reproductive urologist, and we also have a special guest, my husband, Sean. And since today we're focusing on men's health and men's fertility, we thought it'd be fun to bring my husband in for, different questions that, from the men's side of the world.
Wonderful. Lucky me.
All right, thank you for being here.
My
for those
pleasure.
of our community who doesn't really know what a reproductive urologist does, can you tell us more about your profession?
Absolutely. So I'm happy to be here today and talk to you all. So what a reproductive urologist really does is we focus on the diagnosis and management of all things related to the male side of infertility. So whether it's hormonal management, genetic testing, evaluation for potential anatomic abnormalities that can lead to infertility, we kind of run the gamut in terms of testing, diagnosis, and then eventually surgical management as well, whether it's a varicocelectomy or sperm retrieval, whether it's needing to be done under the microscope. We kind of run the course, and we're very intimately involved with the reproductive OBs on the female side to then be able to get the sperm and egg together and then hopefully childbirth.
What are the stats on that? Because what is the infertility of men, or what does that look like?
Yeah, so the way to look at infertility in men is, unfortunately, it's becoming more and more prevalent for a couple factors. So people are getting married later in life, they're having children later in life, they're encountering the issues related to declining sperm counts globally. And I see this not too infrequently, where I see a normal, otherwise healthy male come into my office with 0 sperm in their ejaculate.
Wow.
And they go to the gym, they exercise, they eat healthy, they're not overweight, they don't have diabetes. So it's always interesting to me to see these guys in the office and you would never really know otherwise, and you do a semen analysis on them and it's totally 0. And the way to kind of understand the fundamental basis behind that is there are a lot of environmental factors, so microplastics, chemicals, the Wi-Fi reception in our cell phones. I'm a huge proponent of don't ever put your cell phone in your pocket. There was a study published about 2 years ago looking at Wi-Fi radiation, and it's actually the Wi-Fi that impacts sperm motility, morphology, and overall concentration. So
that's funny that you mentioned that, because I actually am a big stickler of my kids not having their phones on their laps, and I have 2 girls, which could be said about the radiation from that and
possible.
Sperm. But even with the boys, my nephews and everything else, it's not, I don't think it's ideal to have that. And so,
I totally agree. And, I tell my guys when they come into the office, you sit in the car, put your phone in the cup holder. You sit at dinner, you put your phone face down on the table.
Right. That's what I do.
practice.
Yeah.
And we don't really know. This study was probably, it was published 2 years ago, but probably only looking at a certain subset of data. But if you extrapolate this out to 20, 30 years of keeping your cell phone in your pocket, you're essentially radiating your testicles, and we don't really know the potential complications in terms of testosterone depletion, because testosterone comes from the testicles. So if you look at potential spermatogenic injury or injury to the sperm producing cells in the testicles, you can also make the same argument for the testosterone producing cells. So,
well, now speaking of that, does size matter?
Size actually does not matter when it comes to testicles. That's a great question. I would say it matters insofar as to say you still need normal amount of volume in the testicle to then be able to make sperm and testosterone. But whether I see a guy with 24 cc testicles versus a guy with 16 cc testicles, I mean, they're all gonna be.
Does that like hang or just like what is that? What is that?
It's more volume size.
Okay,
So I wish I brought like a model to show you the differences in sizes of testicles. But obviously, if it's like the size of a peanut, yeah, you're probably gonna have problems.
Right.
But size doesn't matter all that much when it comes to having just at least a normal volume to then be able to say, okay, the testosterone production is probably normal and the sperm production is probably normal.
So what else are you seeing in male infertility? Let's talk about. So I think with technology being such a huge part of our lives, that is definitely something more that we should be aware of. What else are you seeing in your practice of like leading causes of?
Yeah, so there are a couple. So genetic is one. That's something that you can't really take into consideration. You always ask, any infertility issues in your family, anyone that you're aware of have any issues with conception. So always do genetic testing. And the most common causes of genetic abnormalities are Y chromosome deletion. So whenever you go to a reproductive urologist like myself, and there are a handful of us in Southern California, but they're all over the country. You want to make sure if you have a sperm count, my threshold's really below 5 million. If you have a sperm count below 5 million per milliliter, you should do genetic testing, get a Y chromosome deletion, and also look for karyotype to see if there are any chromosomal abnormalities that could potentially be the factor. Other things that lead to infertility, anatomic. So the most common cause of an anatomic issue leading to subfertility or infertility is really what's called varicoceles. So everyone knows what varicose veins are. You see them on the legs. They're kind of these dilated, unsightly veins. But what ends up happening, so if you think about it evolutionarily, the testicles are outside of a man's body because it's about 1 degree Celsius cooler than inside the abdomen. So the spermatogenic or the sperm production process in the testicles are temperature dependent. So when you have dilated veins around the testicle, which are more common in, unfortunately, taller guys, because there's a much longer path that the vein has to carry the blood before it goes back to the heart, what ends up happening is you get this pooling effect, and the blood just pools and it's trapped around the testicle, and it heats up the testicle, and that invariably ends up impacting sperm quality, quantity, and production. So anatomically speaking, that's something to also rule out. And then, going into other more common factors, hormonal is something I'm seeing a lot more of. I'm seeing a lot of these young guys who go to these testosterone clinics, and I'm not going to name any names, but there are a few of them out there, and they get jacked up on testosterone. They come in, their testicles are really small. They basically stop producing their own testosterone, and then their sperm counts are 0, and they're like, no one counseled me on this. No one said I'll have fertility issues. So, I think having those discussions, and if someone really wants to pursue that bodybuilding aspect of whether it's their career or recreationally, I think it's important to have the discussion of sperm banking. It's so easy nowadays. There are a couple companies online. There's one that I recommend, Fellow. They send you an at-home kit. You send it for analysis to them. You overnight FedEx it, and then they store it, and you can bank sperm if you want to use that in the future before you consider going on testosterone replacement. So getting that hormonal aspect kind of dialed in and tuned up is something to really talk about with patients. And I don't think these community testosterone clinics are really doing that.
So it's not as invasive as when women are banking their ovaries, right? We're just doing it normally like we would just normally do it,
this
right?
is a normal ejaculation, as they say.
All right, cool. How long does that last? And when should we think about doing that?
So, depending on the company, I think you can bank for certain periods of time, whether it's like a 1-year bank or a 3-year, or 5-year, or 10-year, etc. It's really whatever kind of the length of time you want to bank for. And then
so it lasts that many years, like 10 years if I'm
they put it in the cryo chamber, they freeze it at sub-zero, and it's pretty much good for many years. I don't know what the shelf life is of frozen cryosperm. I should have looked that up before our discussion.
It's very newer technology, so I'm sure we're still learning about it.
We are, and I think the commercial availability is expanding. Every couple of years you hear of a new company doing this, And I think overall it's great for society because a lot of times people are delaying, having children for, later years in life because they're, for example, me and my group of friends, like we went through 10 years plus of med school, residency,
Right.
fellowship. So there are a lot of kind of career pursuits that then cause you to delay fertility. And on the female side, same thing. I mean, um, fertility really in women, and I'm a urologist, I only really see men. I see women for like, recurrent UTIs, kidney stones, things like that. But I don't want to overstep my bounds here. But, after age 35, there's a precipitous decline in fertility in females. So when it comes to freezing eggs, it's a much more involved process. They have to give injections, and the OB has to go in and actually retrieve the eggs. It's an
Right.
invasive process. Whereas in a
Right.
male, they basically ejaculate in a cup and they FedEx it to the facility overnight. So it's a much easier process to consider.
Well, and at We Natal, the whole reason this brand came up was because there was such a lack of resource and education that men are 50% of the equation when
Yeah,
it
it's
comes to
true.
fertility, and men, up until we created this brand, we found are very little part of the conversation unless there's trouble, in which case they might come see someone like you.
Yeah.
But historically, women have carried the burden of fertility when men are equal parts, and why I believe men are so lucky is that you're regenerating sperm every second, every day. And then with 3 months of a healthy lifestyle and supplementation and good diet, you could completely change that batch of sperm and freeze it or try to conceive or whatever. And so you can really put your best foot forward for your future offspring.
I totally agree with that. And that's the fascinating thing about like the male side of things. I always tell couples when they come in, 50% of the time it's the guy.
Yep.
And whether it's hormonal, anatomic, genetic, we always obviously have to do the full workup. But a lot of times there are what's called unexplained infertility. We do the full workup, and a lot of times we just can't figure out what it is that's causing either the subfertility, meaning a low count, or the infertility, meaning zero in total. So I think the onus is shifted on the providers and also the patients to become more educated in terms of, okay, how long a period of time should I wait before seeing a reproductive urologist? When they come see me, they've already been trying for 6 months to a
Right.
year, no success, and coming in to kind of say, okay, what else do we need to do moving forward? And it's usually about getting them teed up to maybe go on to assisted reproduction, whether it's IUI or IVF.
But also put their best foot forward if they're doing that.
100%.
Yep.
Is there any way that we can help self-detect or see or taste or something that would tell us that our sperm is defective or
It's a great question.
no?
That's a
I
good
don't
question.
know.
Yeah.
I mean, or is it just like only under a microscope and good luck?
No, I think, well, it is really only under a microscope and good luck, but I think there are some other things you could do, like obviously hormonal testing and things like that, just to make sure your testosterone's in a normal range.
Okay.
Guys with low T, the problem is that you need a normal amount of intratesticular testosterone, meaning testosterone levels inside the testicle, for that sperm factory to be up and running. So whenever you have long-term low testosterone that goes undiagnosed, that can then lead to sperm production issues. So when you say like, is there something to do at home? I mean, you could talk to your primary care doctor, get a baseline set of labs, maybe have them check a testosterone level. They probably won't readily check the hormonal levels like from the pituitary gland, LH and FSH, but get a baseline testosterone. If it's low, maybe consider talking to a urologist about going on a medication like Clomid. I use Clomid. They use it on the female side as well. And the nice thing about Clomid, for example, is it tricks the pituitary gland in the brain, which sits right behind the eyes, to then send more signal to the testicles to make more LH and FSH to be released, to then trigger the testicles to make more testosterone and to make more sperm. So I use it in guys who want to boost their testosterone levels, but also preserve fertility. I also use it in guys who want to boost their sperm counts, but they have like maybe a borderline low or low normal testosterone. So I use it in those settings to kind of boost their sperm counts. So yeah.
I love it. And so what is the significance of also sperm count and morphology and motility? Like, how do you look at those parameters?
Okay, so the parameters I really look at, first and foremost, volume. You need to have a normal volume of ejaculate to then be able to carry the sperm to the finish line to get to the cervix.
Right.
So Usually about above 1.5 milliliters is considered normal volume. I think volume's an important one. There are ways to make sure you enhance the volume. I kind of don't put as much weight on it in a collected specimen because guys invariably end up ejaculating less during a collection than they would kind of in the wild, so to speak. The next thing I look at is concentration. So above 15 to 20 million depends on where you're looking at, but like my threshold's really above 20 million. You're technically considered normal, and that's 20 million sperm per milliliter of ejaculate. So if you have 2 milliliters of ejaculate, 20 milliliters of sperm, you got about 40 million sperm per ejaculation.
Wow.
And that's kind of like the low threshold baseline that you want to try and get above the 20 million. And then the third thing I look at is motility. So the typical normal cutoff for normal motility, and that's like forward moving sperm, is about 32%.
Mm-hmm.
So there's really three types of sperm when you ejaculate. There's sperm that don't move, there's sperm that literally just twitch in place and don't propagate forward, and then there's forward moving sperm. And you need that forward moving sperm to then be able to get to the egg and penetrate the egg and trigger the whole fertilization process. Now, the next parameter I look at is morphology or shape. So when you look at the shape, you need a nice torpedo-shaped sperm. I should have brought a diagram, but you need that torpedo shape of the head of the sperm called the acrosome to then be able to pierce the egg in a female and then trigger this whole fertilization process. So believe it or not, the least important of all these parameters is really the shape. As long as you get the morphology, or sorry, as long as you get the motility up and running and you get the concentration to like a critical mass level, the shape of the sperm kind of becomes less important in some ways. You know, I saw semen analysis today. The guy had 150 million sperm per milliliter, and his morphology is 1%. He's like, he was freaking out about this morphology at 1%, but I was like, look, if you got 150 million sperm, you only technically need about 4% or more normal morphology to reach that normal threshold. And this is based off of what's called a Kruger criteria, where they looked at hundreds of thousands of couples that were able to conceive, and they looked back at the semen analyses. It's a tongue twister. Semen analyses of these couples, and they saw that the guys that were able to go on and have conception, successful conception, they only had about 4% or more normal morphology. So the morphology, I try and like tell my guys, like, don't panic about that as much. It's not as important of all the parameters that I look at.
Does it lead to any defects though, or any
That's
possible...
a good question. So, you know, patients sometimes ask me, they say, well, my morphology is 1%. Like, is my kid going to come out, you know, with a third arm or something? I'm like, no. It's the strongest sperm will get to the egg, and the strongest sperm will fertilize the egg. There's no, you know, the abnormal morphology sperm, like they call it globe-shaped sperm or globospermia, those will not be able to penetrate the egg. So it's not like there's a genetic issue with that sperm. It's just the shape of the head of the sperm didn't, you know, get to the final point in the assembly line where they smooth out the edges and make it a torpedo. So those won't even be able to fertilize the egg.
Okay. How about,
well, I was going to say, I think Sean asked this, but are there any symptoms they should look for? But it sounds like perfectly healthy guys are coming with no symptoms, and you can't really tell. But is there anything men should look for if they're feeling a certain way or think that could indicate maybe subpar fertility? Yeah,
so one thing I have been seeing a lot more of, and I don't know if this is like secondary to COVID or what, but I've been seeing a lot more white cells, or what are called round cells, in the ejaculate in a lot of samples. And I know my partner has also seen the same thing in his practice, and a couple of my friends who are also reproductive urologists have been seeing this as well. So that's really like a prostate or prostatitis type of inflammatory process that's going on in the prostate that's leading to this kind of increased occurrence of white cells in the ejaculate. And the problem with these is,
like, white cells, the same ones that like fight bacteria and stuff like that?
Yeah. So these white blood cells.
Is that good or bad?
It's bad, and I'll explain why. So what ends up happening is this inflammation in the prostate, or this like subclinical prostatitis, meaning they're not having like burning with urination or necessary pain in the perineal area with like prolonged sitting, as you would see with the guy that has prostatitis. They're having these inflammatory cells showing up in the ejaculate, and the problem is there's like this local, I don't want to get too technical, but like cytokine release that then ends up damaging the head of the sperm. So that sperm that gets ejaculated doesn't end up functioning well and can't fertilize the egg because of this kind of local cytokine release from all these inflammatory cells or the white cells in the ejaculate. So
the good cells are being affected by the bad liquid cells or something, or the
yeah,
overall.
so the good sperm cells in the ejaculate
Yeah.
are being. I love the way he describes this. um, there's like a local inflammatory process that's going on because the majority of fluid that gets ejaculated is actually coming from the prostate.
Right.
The sperm contribution to the total volume of ejaculate is like a negligible amount. That's why when guys get vasectomies, I always tell them, look, you're not going to notice a difference in how much you're going to ejaculate.
Oh, okay. See, I was going to ask you about vasectomies. Good, bad, and yes, no. Should we? What happens? You know.
Do you want to talk about it now, or
No,
we'll talk
keep
about it
going.
later?
It was a question, but yeah, just we'll sidebar that one.
Yeah, so this like local inflammatory cytokine release ends up damaging sperm in the milieu, and then that damaged sperm can't end up achieving fertilization of the egg. So, you know, for those guys, I've been putting them on antibiotics, anti-inflammatories, retesting their semen analysis to see if they've cleared the inflammatory cells. But I've been seeing this a lot more recently, and probably like the last 2 years. And I don't know, and no one really has the answer to this. It'll probably become apparent later on. But if this is secondary to COVID or some other kind of long-term inflammatory process that's kind of stuck in our bodies.
And so given that, wouldn't you recommend that no matter where you're at, if you're thinking about starting to plan a family, don't wait till you're having trouble. Like there could be no symptoms and no signs, and you want to optimize both partners. So would you recommend anyone at the start of their journey to becoming parents, the male partner, to come possibly see you?
It's honestly not a bad idea. The only thing is it's probably hard to get into a reproductive urologist. And then obviously, you know, if it's tough to get in and someone else who's been trying for like a year or two really needs to get in, then, you know, you kind of want to like hold off for a bit. But I think it's important to come in, establish a baseline, definitely get a baseline semen analysis, kind of see where your numbers are at, see what you can work on. For myself, I always talk to guys about like the importance of diet and exercise. And it doesn't matter if you're got a, you know, body mass index of like 10% and no body fat or 50%. I'm going to talk to you about the importance of diet and exercise, especially when it comes to fertility and conception. I really recommend not having a sedentary lifestyle. Don't smoke. A lot of guys come in to the office smoking marijuana every night. Oh, it helps me sleep. I smoke marijuana every night. But I'm like, listen, the problem with marijuana and even excessive alcohol consumption, these will suppress this hormone called GnRH. Not to get too technical here, but GnRH gets released by the hypothalamus. That triggers the anterior pituitary to release LH and FSH. So the problem is, if you're smoking weed every night and you're chronically suppressing GnRH release, you will end up decreasing your testosterone production and sperm production as a result of it. Same thing with alcohol. It's a GnRH suppressant.
Yeah.
So
I think this is so important because it's not forever, but if you're in this important stage, these things that are like legalized and very common and much more prevalent,
yeah, for sure.
I think it's so important, and we see more and more people asking this question. So I think that explanation was very helpful.
Well,
absolutely.
Well, playing off what you said earlier, the 30-day reproduction, I mean, so just have to wait 30 days and we're good to go?
So it's a 74-day cycle.
What's a 74-day
cycle? So sperm production is a 74-day cycle. So whatever, like if I did some surgery on you today, like let's say you fixed a varicocele, just picking that as an example, you won't really see the benefits of it for about 2.5 months in terms of like the improved sperm. So same thing, like if you said, oh, I smoke marijuana every night, if you stop today, you probably won't see a benefit in your semen analysis for about 74 days.
Okay.
And even probably a little longer thereafter, because the factory's got to wake back up and all that stuff. But yeah, 74-day cycle is usually
So it's like almost like the guy's birth control.
Well, I mean, not to get into that detailed aspect of it, but yeah, there have been like thoughts of, well, can you put guys on like a low level of testosterone to suppress sperm production, but then like take them off of it to then get back on? It's also not guaranteed. So I have these guys that, you know, they're juicing, they inject TRT, and they're all jacked up, but the problem is, even if you take them off testosterone, it takes about a year before, or up to about a year before the factory kind of wakes back up.
Wow.
What about body composition? We've heard that diet and exercise is so important. Have you seen anything in obese men or different body compositions that could help or hurt fertility?
Yes. So, and I'm not here to fat shame anyone.
No.
This is really just to kind of get everyone like the best care they can get, and health is wealth. Um, the problem with obesity, especially in America, is that we have this enzyme in the fat cells of our body called aromatase. Aromatase breaks down testosterone into estradiol, or estrogen is the way to think about it. So someone with a large body habitus, high BMI, a lot of body fat will convert a lot of their testosterone into estrogen. And so if you need a normal amount of intratesticular testosterone for your sperm production and sperm quality, if your body composition is such that you're converting a lot of this testosterone into estrogen, you're not getting that critical mass threshold level where you need that normal amount of testosterone for not only sperm production, but also like there are a lot of factors that are dependent on testosterone. So skeletal muscle mass, bone mineral density, mood, libido, like there are a lot of things that are dependent on a normal testosterone level in the body. And so, when it comes to obesity, I'm a huge proponent of exercise, especially cardio. You have to do like 30 minutes of vigorous activity at least 5 days a week. I tell my guys, it's got to be to the point where like you have trouble completing a sentence. That's the level of cardio I want you to reach. 30 minutes, 5 days a week.
Love that.
And I practice what I preach. I'm not gonna tell someone to do something that I wouldn't do myself.
I love it.
So my question is the myth between boy versus girl. I mean, do they swim faster? Does marijuana have an effect on that? Does whitey tighties, versus boxer briefs? I mean, what affects that? Because I'm a girl dad and I would love to have a boy, but I don't want to do, I don't want to.
Okay, I'm gonna go ahead and take this. So the Y chromosome is lighter than the X chromosome. So theoretically, the Y chromosome carrying sperm should swim faster to get to the egg.
Okay.
There was a study in 2009 that looked at birth rates the further you get from the equator, and they found that the closer you are to the equator, the higher the probability of having a female child. And the further you get from the equator, it's a slightly higher probability of having a boy. So I guess if you want a boy, maybe take a trip to Alaska or Antarctica or visit Russia. Probably right now is not the best time.
That makes so much sense because a lot of times at We Natal, we talk about things that are healthy like saunas and hot tubs and things that men love, but sperm doesn't really take well to the heat. So it makes actual perfect sense.
So what is and playing off of that, so, should I when is the optimal time to have sex? Like not after I drink, obviously, right? But when is that optimal moment? Like what should I do to prepare for that moment as a guy, to be optimal at fertilizing?
Yeah, so I would say if you guys are actively trying to conceive, there's got to be a washout period where you want to abstain from marijuana, you want to cut back on alcohol, because obviously marijuana and alcohol, they'll both suppress that GnRH release at the level of the hypothalamus, and then you won't get as much testosterone and sperm being produced. So optimizing those parameters. Same thing with like heat sources. Like you mentioned, sauna, steam room, hot tub, jacuzzi, any excess heat, sitting for prolonged periods of time. I tell my guys, look, get a standing desk, stand for, 10 minutes every hour where you're not just basically sitting and roasting your testicles all day, sitting in your chair. So I think all those, if you can start to do that maybe like 3 months before when you actually want to start conception to kind of get that lead time to give that next sperm cycle time to kind of take effect, I think that's probably the best way to optimize your chances of improving overall fertility. But, in terms of like gender selection, the only way to really do that is IVF, unless you,
No.
take a trip to Antarctica.
No.
Hope for the best.
All right.
What other advice do you give as far as lifestyle tips for both partners and specifically our men out there who are trying to conceive? So we talked about cell phones out of pockets. We've talked about avoiding heat.
Yep.
You've been an amazing advocate for We Natal and supplementation, but what are other natural things people can do?
We talked about exercise.
Yep.
I'm a huge proponent of a healthy diet also. So things like a Mediterranean diet, for example, fish, chicken, lean meat, whole grain, vegetables, things that have high omega-3 and 6s, like, salmon, sea bass, different kinds of fish that's found in a Mediterranean diet, I think is super important, especially around conception. Other things, not to name names, but Weenaidle, huge proponent of the benefit of fertility supplements. I mean, there have been so many studies looking at the reduction in reactive oxidative stress and damage to the sperm, which is something you really want to start months before even trying to conceive to kind of set the stage and optimize the parameters and like really optimize your chances of success.
Yeah, agreed.
So relieving stress, meditation, those
all important. Yeah.
That was actually my next topic, because we're all having kids later in life, we're all increasing the stress, and sadly fertility, because of the decline for both men and women being part of our toxic soup we're living in. We're all more stressed about it, and it's a lot more overwhelming. So
let me touch on that.
Please.
So the guys I see in my office, and it really honestly doesn't matter the age, guys in their 20s, 30s, 40s, 50s, there is a certain level of stress when it comes to conception. I don't want to say I coined this term, but like I came up with this thing called peri-conception ED. I'm seeing these like young guys in my office, late 20s, early 30s, doesn't matter. They're coming in for infertility, but they also have erectile dysfunction. And I think the problem is, and I'm going to kind of like get on my soapbox here and talk about this, but if you think about evolutionarily, like why are we all here? We're all here to procreate. That's like the fundamental evolutionary basis for our very existence. So, 400, 500, 600 years ago, the stresses were like a neighboring tribe coming to attack us, or there's like a famine, there's nothing to eat. Those were stressful periods of time. So that cortisol, norepinephrine, epinephrine release basically signaled to our bodies like, hey, it's not a good time to procreate. So, thankfully, by and large, our stressors are not existential. It's like relationship stress, work stress, deadlines, this, that, whatever, social engagements. These stressors end up just giving you this like heightened level of cortisol, this heightened level of norepinephrine and epinephrine. And the problem with these stress response hormones is they basically counteract the ability to get an erection. So even though evolutionarily we're not at war, we're not facing a famine, the evolutionary basis in our body is basically signaling like, hey, this is not a good time to procreate. The stress level is high, so getting an erection, keeping an erection becomes much more difficult. And so I have a whole other discussion with those patients about, starting supplements, starting, even Cialis or Viagra for even young guys. I mean, it's not infrequent. I see guys in their 20s, late 20s coming in talking about conception issues and then, having to end up starting them on Cialis. So it's becoming much more prevalent. And really the key is to talk to these guys about, number one, how normal it is and how common it is, and kind of like get that shame off of them. And they come in sad and depressed basically. But yeah, normalization I think is really important. Having these frank discussions that, look, it's really common, it happens. And really the key to think about is minimize your stress. I know there's also a lot of like, with the issue with periconception ED is like the female partner is like, oh, I'm ovulating, like it's go time. And the guy's like, what are you talking about? I'm not in the mood. Like I was just working for 12 hours and whatever. So I think getting that kind of out of the way, like, look, we just got to minimize stress, meditation, yoga, whatever it takes to de-stress without smoking marijuana or drinking excessively. I think those are really important for kind of like getting the milieu set up for success, really.
Does ED lead to infertility? No, right?
No.
But you can't get pregnant because you can't obviously get hard and you can't just
can't ejaculate. But really the thing is you also want to do like hormone testing. So is the guy's ED because his testosterone's like 130, which eventually will kind of take you down this rabbit hole of like, is there a pituitary issue? Is there a testicular issue? So I think even getting something like erectile dysfunction around the time of conception, you should probably see a urologist, or even better yet, a reproductive urologist. Kind of get worked up, see what your testosterone level is, see what your pituitary hormones are like, LH and FSH, just to kind of get this like 10,000-foot view of, okay, how are the hormones all interacting with each other?
Gotcha.
I think that's important.
So it's a factor of understanding your hormones plus the stress factors.
100%.
and just environment, right?
Yeah, and
And something that you mentioned is like, the ovulation and timing. That's easily done. It's, just talking to your partner and just saying, hey, I'm on this schedule. Let's plan this accordingly, right?
Yeah.
And so that could alleviate that kind of stress.
yeah, like skip the gym, skip your rigorous
Yeah,
workout.
let's just get straight to work, baby.
There you go.
Oh my. I I want to say like so much of this I think is going to help so many people because fertility is a team sport and historically a lot of us as women take on the burden and you're kind of busting myths. You're helping us look kind of behind the covers and say what we can do, what's within our control, the optimism I think we wish we had of what partners can do together and how men can really step up to support their partners.
100%.
It's an exciting time. I think, listen, it is, fertility is on the decline and but there's still so much optimism and hope around what's within your control.
Yeah.
And I think that's our message, that there's low hanging fruit with just your everyday decisions, getting really clean water filters, fresh air, oxygen, plants, meditation. There's things in our everyday habits, like small tweaks here and there, that will make big differences in your overall health. And your overall health and fertility are linked. And so people kind of put fertility in its own island, and when they're ready to hit it, they want to optimize it. But really, taking care of yourself, all of your advice is Mediterranean diet, exercise, all these things are great just for your overall longevity. And so it's exciting to hear that there is so much you can do, and there is reproductive urologists that can guide you. And so maybe don't wait till you're in that aggravated, this is my last option. Maybe if you feel something's off, I think it's so important to get ahead of it and realize what's in your control.
100%.
Absolutely. The lifestyle change that you do is very important. I mean, it's part of that journey, right? And trust me, after you have kids, your lifestyle changes again, and it's not healthy eating. It's, go, go, go all the time. You're pretty much giving up a portion of yourself for that kid. One final thought for me is the last, after listening to something for 45 minutes or anything was, my biggest takeaway is what should I do, or no, better yet, what shouldn't I do before conception? So obviously you said don't smoke weed, don't drink, change my diet, lifestyles. But what else? Yeah. So heat sources, outside of those things, what more can I do?
One other thing you had mentioned earlier about the tighty whities.
Yeah.
So I think you want to keep the boys cool down there. So boxers over briefs.
Okay.
Keep them cool. I always say whenever you exercise, go shower immediately afterwards. Try not to sit in sweaty underwear. Try not to sit for prolonged periods of time at work. A lot of people work desk jobs or they work from home and they're sitting for 8 hours straight. I think sedentarism is bad. The importance of diet and exercise can't be emphasized enough. And then also, fertility supplements are a great idea to incorporate into your routine. It's easy. There's no side effects to it. It's all natural supplements. So, including that in your diet and routine as well. And that's pretty much all I got.
And
how about
fun.
quantity? Yeah, the fun part. How about quantity of times? Every other day, every day, every 3 days? Because, you only have that, little window of
So sperm can live in the vaginal canal for up to 7 days. Wow. So you should start, I recommend 2 days before that, ovulation cycle spike starts. You should, take shots on goal 2 days before, and then the day before, and then day of, and then day after.
Okay.
I think those are important things to think about. It's really taking shots on goal and making sure you're timing it well.
Okay, so speaking of that, and I didn't know if I should ask this or not because I've been thinking in the back of my head. Do you release on the thrust in, right? And then hold it and then thrust in again, release? You want to control that or
This is a question I've never been asked before, but I mean,
it's
I would imagine, you fathered 2 children, so you must be doing it right.
I try to say these things, and I swear by the pull-out method too. I swear by that, and also by the thrust-in method. The pull-out method just to prevent pregnancy, obviously, right? And then the thrust-in to
conceive. You got to think about, you want to get the sperm as close to the cervix as possible to then be able to enter the cervix. So yeah, there's
some tricks
there's some
possible,
tricks
some mythical tricks.
Well, we've also heard the myth of just have sex every day, and I don't think you're saying that either. I think
No, I think it's gotta
some
be
value
timed.
in, but
No,
also is there value in like building up a little bit more, so every other day? I don't know. You tell us.
So, you know, the build up is really like a volume thing. So, I look, I'm the male side expert. I'm not the female side expert. You could probably get, you know, an OB to speak better to this, but you know, if you look at sperm lives in the vaginal canal up to a week, you kind of want to start the process maybe a little bit before. So once the egg's all ovulated, there might still be some sperm kind of in the neighborhood, so to speak, just hanging out. So I would say, you know, try and aim for like 48 hours before, day of. Some people say every other day, but I think, you know, if you're right around that kind of peri-conception window, you know, taking shots on goal every day is not a bad idea.
Okay.
Yeah.
I love it.
I like that, shots on goal.
Well, you've been amazing. If people want to follow along and learn more from you, where can they learn about you?
So they can check out my Instagram at muradzadeh.urology, or if they want to come see me or telehealth or in person, I've got 2 offices, one on La Cienega and then one on Admiralty in Marina Del Rey.
Amazing.
Yeah.
Thank you for being
My pleasure.
here.
This is a lot of fun.
This
I
is so
enjoyed
much
it.
fun.
Thank you guys. Yeah.